And let me start by introducing our panelists for the third panel. Our moderator is Susan Dentzer, who is now editor-in-chief of Health Affairs, the nation's leading journal of health policy. She's also an on-air analyst, or continues to be an on-air analyst on health issues with the NewsHour with Jim Lehrer on PBS. Joining Susan on the panel are three people who truly are experts in what the public is thinking. Neil Newhouse is a partner and co-founder of Public Opinion Strategies, which has been described by the New York Times as the leading Republican polling company in the country, and his firm was named Pollster of the Year by the trade publication Campaigns and Election in the 2002 election cycle. Neil's gotten praise from both sides of the aisle for his broad range of campaign work and continues to have a big impact on political campaigning. Stan Greenberg is the founder of his polling firm, Greenberg, Quinlan, Rosner, after a decade of teaching at Yale. Stan provides strategic advice and research for leaders, companies, campaigns, non-government organizations who are working to advance their various public policy issues and other issues in these changing times. He's also served as a pollster for many international leaders, not just here in the United States, people like President Clinton and Vice President Gore, but also British Prime Minister Tony Blair and presidents of nations from around the world. So looking forward to hearing their perspectives given the recent election and given the prominence of health care and its relation to other economic issues right now. Finally, again, not least, is Jim Guest, the President and Chief Executive Officer of Consumers Union, who has a long career in public service and working for the consumer interest. Thanks in good part to Jim's leadership, his organization has become very focused on health care. In addition to publishing consumer reports, Consumers Union has launched several newer initiatives, including ConsumerReportsHealth.org and the Consumer Reports Health Rating Center, which serve to educate and provide information in a way that consumers can use to make more informed healthcare decisions and get to some of these goals of better care. Susan, let me turn this over to you.
Great. Thanks very much, Mark, and good morning to all of you. When we think about the public's involvement in healthcare and healthcare reform, many of us who lived through 1993 and 1994, I guess all of us lived through 1993 and 94 with perhaps varying degrees of attention being paid to this, but most of us will remember the famous comment made by an elderly woman who ran into then Senator John Breaux in an airport in Louisiana and applauded him for his efforts on health reform, and then said to him, "But Senator, whatever you do, don't let the government take over my Medicare." This being thought of as the emblematic piece of public opinion on health care reform, and underscoring Congressman Barney Frank's famous statement that people complain about the politicians, but the voters aren't so hot either. As we move into an era where the voters are going to be asked, if we take Senator Baucus at his word, and we are going to see some major moves on health reform very soon, we are going to actually be depending on these voters to support those efforts. And I think that gets us to our conversation today. Our panel was charged with asking two questions. What does the public understand about healthcare system problems and solutions? And what might be done to educate the public better? What are the messages that could generate support for broad-based reform? What would cause people to lay their concerns aside? Now, we know that those concerns are already legion. We know from the polls Stan, you and Neil have done, that people who voted for Barack Obama placed third on their list of reasons that they voted for him, that he would produce a system of affordable health care for all. We know that there's enormous frustration with the U.S. healthcare system. The Commonwealth Fund surveys show 3/4 of the public or more wanting a completely rebuilt healthcare system, or one that is improved in major ways. So the expectations of politicians now are quite high. On the other hand, we also have as the iconic voting figure of this year, Joe the plumber, whose basic concerns appear to be that he's distrustful of taxes, distrustful of government, and as we've been hearing for the last couple of hours, much of what we're talking about are major, major actions instituted by governments to reform the private system, possibly with some additional taxes down the road. So with that by way of introduction, Neil, let's start with you. Your party was on the losing side, so we'll let you go first.
I thought it was the other way around.
Okay. What do you see as the best, what's the current understanding of the public?
Well,
So what are the best potential means for improving that understanding and getting buy-in on any reforms that go forward?
Right. I brought a few slides from a PowerPoint, if we can bring those up, if that's at all possible. I'm sorry.
Say it again, Brett. Experiencing technical difficulties. So.
Okay.
Fixed by time mine.
I'm sure they will be. All right. Well, let's start with I think, you look at the big picture here, and I think you pinpointed exactly the priority of the healthcare issue in the exit polls. The problem is the healthcare issue is being completely overwhelmed by the major concern about the economy. President-elect Barack Obama's to-do list is an extraordinary to-do list. It starts with obviously with the economy, auto industry, unemployment, bailouts, Wall Street regulations, economic stimulus, mortgage foreclosures. There is no other issue than the economy. Now, of course, healthcare reform falls into that, but it is number one. It's a public that is dominated by concerns about the economy. And secondly, if he had his number two priority is going to be getting troops out of Iraq. That's number one and number two. And beyond that, everything else is going to pale. So I mean, this is not like the 1992 kind of groundswell support for reform that we thought was there. This is now overwhelmingly concerned about Iraq and the economy, and then underneath that, the two major issues of healthcare reform and energy independence. And I think, and that's enough for 8 years of Barack Obama's presidency, potential rather than just 4. So those are the top two issues. And when you get to cite the data on healthcare reform, what's really interesting when you go through the data is there is no question that Americans overwhelmingly believe it ought to be reformed. They think it's time for the status quo in healthcare is about 15%. Nobody wants to keep it as it is. But then when you ask Americans, how about your health care? How do you feel about the delivery of health care to your family, you and your family? 70% of Americans express confidence that they're getting the quality of their care is pretty good. Then when you just juxtapose the question, you just flip it and say, how about the rest of the country? And the rest of the country, the number is just inverted. About 20% say the health care in the country is going well, and about 70% say it's off on the wrong track. So it's almost like I'm okay, but the healthcare system nationally is broken.
And that's a typical response that people have about Congress versus their individual member of Congress.
Don't go there. Don't go there.
What's the dynamic?
No, Congress.
Tell that to the 50 members.
Yeah, exactly. No, Congress. They hate Congress and they're lukewarm to their congressman. This is. I'm okay. My healthcare delivery system is fine, but the rest of the country is really hurting. In fact, if we can go down a couple of charts here, you were right. It did come. Go back. That was fine.
All right, about that. Which one, Neil?
Okay. That's actually radically changed. 1/3 of Americans believe the healthcare system in the country should be radically changed. 51% reform, just 12% status quo. Remarkable numbers. And from that, we would obviously take that there is a significant sentiment for change. And the next one. And yet 71% say they're happy with their own health care, compared to 24% say that they believe that the health care in the country is going well. So these numbers are just the inverse of each other. And
so
then,
what's the disconnect?
Well, here's one more. The trade-offs, in order, what I think that one of the major pushes on the health care issue over the next few years is not going to be cost is really the major issue, but over the next few years, because of layoffs, I think it's going to be the number of Americans without health insurance. I think it's being driven by the real concern about the economy. And when you ask about the uninsured, what are the trade-offs? Reduce access to health care service among those who are currently insured. 80% say that's not acceptable. 61% say it's not acceptable to raise taxes. 57% say it's not acceptable for more government involvement in managing the healthcare system. And then finally, 34% and 34% say it's not acceptable on employer mandates and individual mandates. So there's a disconnect here in terms of the need for reform, the perceived need for reform, the perceived nature of the problem. It's not me, it's you, and what Americans are willing to stomach in terms of what's acceptable to them to help solve the problem. But I think this is where we're headed in terms of covering the uninsured. Even though the cost is a major issue people are concerned about right now, the news stories over the next couple of years are going to be about those who are laid off and unemployed and don't have health care coverage.
And if you had asked a Don Berwick-style question or a Denny Cortese-style question that didn't say reduce access to health care services, but said give you much better value for health care services.
Nobody's going to believe that. I'm not sure that's a believable proposition.
Okay, then, Houston, we have a problem. Stan.
Okay. Well, I'm guided in this by the Pakistani taxi drivers who I always ask about what's happening. And they always had a rule on the election. Actually, they would volunteer it because they began to know who I was. And the rule was that Obama has to be ahead by 6 points or else he's not going to be elected president of the United States. So there was the Pakistani 6-point rule for the election. Now the point, and raised before I came to give this speech from my Pakistani taxi driver, was, but is he going to be able to keep any of his promises? Which is where I think we will now focus. I was there in the painfully as part of the process with others here dealing with the Clinton health care plan after the 92 elections and the 94 debacle. So we know how it can go badly wrong. I think we're in a very different moment. I'm not. As I listen to you, I think I'm in a different place on how I think this plays out and what role the public plays in it. I actually won't go through my slides except maybe one slide. But what's clear from the post-election polls and the exit polls and everything that there are 4 issues that people think are going to come out of this. That Obama and the Democrats are going to focus on the economy and creating jobs. Above all else, energy independence, getting off foreign oil, affordable health care for all, and getting out of Iraq. Since President Bush is going to sign the withdrawal and on a fixed deadline from Iraq now, we only have to worry about the implementation of George Bush's policies for Iraq. But whatever battery of questions we go through, you end up with those the 4 cluster of issues as what people expect to come out of this election. I think there's more space being given to them given the scale of the crisis that we're in the middle of. But the mandate matters, and the learning and the election process matters. How people became engaged in the process, matters. Healthcare affordability. This is not just a choice of word, in surveys. This was not about uninsured. This was totally about cost. It was totally about affordability. And affordability encompasses rising premiums, rising deductibles and co-pays and total costs that are borne increasingly by employees. And there is an acute sensitivity to rising costs, particularly now, just as there was over gas prices when those were rising, particularly now. And so it's a cost-centered, not an uninsured, piece. And the other part of it is that people get. It is totally integrated with their understanding of the economy. This isn't about the insurance companies. You come out of 92. First of all, we did run on universal coverage. The showing during the president's speech of the card, your insurance card, that you cannot lose, was a total. The underlying principle, the fundamental change was that everybody was going to have insurance. Okay, this is not about that. This is about affordability. And that a almost 2-year campaign led to an election in which affordability is talked about as the mandate and what the president has to address, totally changes the scope of what has to be addressed in this. There was an extraordinary engagement of the public in the primaries. There was a high level of engagement, as we know, in the election process itself. I remember the failing of the Clinton health care plan. I remember the battle over trying to get the unions to support us in order to advance the plan. It was a struggle to get union support, until it was decided that whether Cadillac healthcare plans were going to be, whether they were going to be taxed above I think it was $5,000 at the time. But there was the issue of taxing Cadillac plans kept the unions back. Unions in many of the industrial unions sector were not that sure that this plan was one they wanted to support. We're in a totally different place. Those, as we've seen in the auto industry, know that their insurance is at risk. The service sector unions are much stronger. When we tried to get the DNC and others to pay for ads for support of the plan, we had it was a couple $1 million for the total effort on behalf of the health care plan. We're dealing with a total shift of civil society, in which I think puts this in an entirely different context. The Clinton health care plan died in committee. Okay. Can you imagine in this environment if they came forward with a health care plan and it got in trouble in the Energy and Commerce Committee, and Nancy Pelosi or the leadership of the Congress or the president saying, "Okay, that's the end of health care plan. We're not going to go forward." There would be a massive engagement of the public around this process to force this into. Now, the other side of that, and I'll just show one slide. I'm sorry, I've gone more than 5 minutes. Go to the next to the last slide, which has to do with whether you want, we can read it. So the question we ask is whether you want to move on health care, boldly, or whether we should go step by step. What you see is their country split actually, a plurality, I think, for step by step. When we get to the economy and a recovery and jobs, people are for moving now. Move. And they're risk averse. The status quo is too big a risk. They want to move. On energy, they don't trust the private sector actors. There's much more confidence in government. Okay. When you get to healthcare, people are more nervous and more risk averse about the kinds of changes you make. So while we're going to operate in an environment which I think is going to be, there will be momentum for change and there'll be engagement of public to try to move the process forward. The public is not, almost half the public wants to move boldly, half wants to move carefully, and so you've got a risk-averse public, which is obviously creates opportunity for those who don't want to see it happen. And I'll just end with the part of the discussion here has been over a bipartisan process. Elections matter. John McCain offered a market-oriented solution on health care. I'm sure it was caricatured in the attack ads that said he's going to tax their health care benefits. But regardless, no one's going to be coming forward with that type of incentives away from employer-based health care to a market process. The elections matter, and so we're going to be operating within a context in which I think sectors of industry, major sectors of industry, will be at the tip. Bipartisan will mean not so much parties. It's going to mean different sectors of the economy who know this change need to happen, and President Obama trying to bring them together to move toward a solution.
Okay, well, Jim Guest, you have your fingers on the pulse of this risk-averse, cost-averse public. How do things appear to you?
Well, most of all, it is a cost-averse public. I mean, we've got our Consumer Reports National Research Center surveys pretty much say the same things that you're saying. And what we find out from the surveys from the focus groups, we can talk about quality of care, we can talk about access, we can talk about all of that. What's on people's minds, if it's real estate, it's location, location, location. For consumers, it's cost, cost, cost. That's really, when you ask all the things, that's what they're very much focused on. And so I think, again, we did a recent survey mid-October of what's happening to people in the economic crisis, and got some very sobering returns. I mean, one out of 5 consumers say they're unable to afford their medical bills or drugs. 15% said they've lost coverage already. 1 in 4 say they've put off doctor's visits or getting medication because of the economic fears. And all the way through. When we talk, we did an article last March where we talked about healthcare. People are fear of being bankrupted. 7 out of 10 fear they'll be bankrupted if they have a major illness or accident. 8 out of 10 think are concerned they'll be unable to afford coverage when they retire. 2 out of 3 fear of losing health insurance coverage if they lose their job, and so forth. So I would say, in terms of now where does one go? I think the prescriptions that we heard in the two earlier panels are fairly consistent. The findings about public attitudes on health care are fairly consistent as well. How do we link those together in a way to try to mobilize public support in a way that it hasn't really been there, hasn't been galvanized for major reform? I've got a few ideas we maybe talk about in the Q&A, but one of the things that's crucial, we've heard all the national statistics and the survey results and things like that, but I certainly think that to get the public mobilized for health care reform, it's all got to come down to the personal level. We actually set out this summer. We've got to ourselves have a sort of a health care reform campaign that we're engaged in. We sent an RV around the country with 2 grassroots organizers and a videographer collecting individual stories from their experience with the healthcare system. And I actually think if we've got the technical skill here, we could just give you a sense of that. Maybe without the sound. Can we get it with the sound?
Yeah, it's probably even better.
Yeah.
I'm a kidney specialist working in Illinois. I currently don't have any insurance. I developed diabetes around age 33. No matter what job you do, if you have a pre-existing condition, the likelihood of you getting health insurance at the moment is almost nil.
I accidentally lopped off one digit of my thumb with the splitter. You know, and I thought about the fact that A, we didn't have insurance, B, it wasn't a life-threatening situation. The sacrifice of a thumb was far less than losing my house for my wife. You know, something that we worked so hard for, our business. You know, to go bankrupt to avoid that sort of thing, that wouldn't be right either. You know, we went the economic route.
I had my heart attack on December 25th of 2005, and that ended my teaching career. I didn't have medical insurance at the time. The bills really put us in a deficit. I lost my car and my home. I've decided that I probably will file bankruptcy.
I had an accident, so they called it a air ambulance, or a life flight. The ambulance company I called wasn't a preferred provider. It blows my mind that in my greatest moment of need, they're just going to reject me and tell me, I'm sorry, that you should have read your contract a little bit better, but you're not covered. I've exhausted all my means that I know of how to deal with this. So kind of at my wit's end at this point with the $9,000 bill over my head for getting an ambulance ride to the hospital so I wouldn't die.
I experienced a miscarriage and wasn't able to seek medical treatment. I just kind of went to bed for about 3 or 4 days and hoped that, it would heal itself.
I have not had a pap smear in over 2 years, and that's a little frightening at my age.
It's not fun to bring somebody home who was supposed to go in the hospital for 4 days and come home 18 days later with somebody who's legally blind and brain damaged as well.
Lewis was a remarkable boy. He was given improper pain medication. They were astonished when he died.
Well, I had to make a decision about either starting my own business and doing without health insurance or going back into the employment market. I quickly realized the American dream of owning your own business and being an entrepreneur is only for the young and healthy.
So just in a nutshell, I think the challenge is to take what you're talking about here and do 2 things. Translate it into terms that the average person can understand in a personal way. Educate the public, educate individuals through various means about both the problems in the system and how the changes we're talking about will in fact be good for them, will be good not only for their health care, but for their pocketbook, and then to activate people. And we can talk more about how to do that. But I think the audience is different this year than it was this time around than it was 15 years ago. And the tools, through the internet, through the kinds of mobilization that can happen, are there. And now the challenge is, I think, to sort of come together on the major elements of reform that most folks are talking about, and then bring the public along and get the public bringing the pressure on Congress and policymakers. So that's the next step in making something happen.
Well, it also sounds as if some of the goal has to be bridging the gap between the people who Neil mentioned, who think their own care is just fine, it's just everybody else's is so bad. Bridging the gap between those folks and the people you just filmed there, who can testify to just how screwed up things really are. Neil, do you have ideas about how that happens?
That's an extraordinary job. And in one of the memos I reread this morning that was handed out to us ahead of time, the question was raised: who can lead this fight? Who's the spokesperson? Who can we turn to? And I go back to what Stan said: the Democrats win this election. It's Barack Obama. I mean, it's got to be. He's got to make this fight, and he's got to lead on this issue to make Americans pay attention. He has the attention of Americans like no president in, I think, recent history. And he has a ton of political capital. And I think he's going to have to, if this is a priority, he's going to have to make it himself, because I don't think there's any other kind of spokesperson out there who can lead this fight.
Let's open it up to some questions from the audience, and we'll continue some discussion around how we do this, because the how of this, Jim, as you identified, is critical. Let's start over here with Gail Walensky.
Hi, Gail Walensky from Project Hope. The numbers that you showed, the disconnects, are what existed in some ways with the public in the 93, 94, although there clearly are some differences. So it's the what do we do now? Because I'm concerned when I see polling that suggests when people talk about health care costs, they only mean their own costs. I mean, they mean the affordability, the deductibility, the deductions, the premiums, the co-pays. They're not really worrying about what we talk about here, the systemic general affordability, the systemic costs. Right. And when you look at the litany of issues that the president-elect is going to face, is it your sense that because this is not likely to be number one, it's going to be the economy and the whole panoply of activities associated with it, that it would be reasonable for the Congress to try to pick a few areas where the Congress may be able to provide some leadership, and then assume it will either be years 3 or 4 or years 1 of a second term of Obama? It sounds reasonable. Having his own credibility and trying to drive change may be able to get around the box that we've been in the past. It's just hard to see that realistically happening in years 1 or 2, given the issues that you've identified, both the economy and clearly getting out of Iraq, and maybe the energy independence before that. So it's what do we do to get something done if there's some question that we actually can get a major involvement of a president when there are so many ways to screw up this ability to go forward.
Stan?
I think it would be a mistake not to address this as part of the first wave of things that he does. The economic recovery plan may be on its own. But the point I was making about insurance companies and the critique, that was part of the attack 15 years ago. People understand that the healthcare affordability is totally linked to changes in the economy. They understand what's happening to the globalization. They know what's happening to large scale industry. They know what's happening to non-competitive employers because of the burden of healthcare costs. They know this stuff is structured into the economy. So I think it's very hard to address the economy and how people are experiencing this economy and leave healthcare out of that equation. People already have, I think, a quite integrated view of it. You also have, unlike 92. In 92, Democrats lost seats. there's been a change. We've had two-wave elections, 2006 and 2008. You've had in total 50, basically 10, senators, 50 new House members who came in the same wave. This is not in '92. Ross Perot, got 20% of the vote and was talking about deficits. And most members of Congress, who were swing members on kind of health care, had a majority of people who had voted for George Bush and Ross Perot. These are part of this is part of a wave that includes the new members, as well as the president. And so I think it would be a mistake I don't think you have to convince people that health care is important and it's a big problem. I think they get that. We don't have to convince them that this is central. I think that's there. What they're worried is you're going to screw it up the way you do it. And to me, what was most impressive about, and I watched it happen with Blair in his first election in Britain, where they reassured about not raising taxes, about freezing the budget at the level that the Conservatives had. And what happened was the more they reassured, at the very end there was this surge in support for spending on health care and dealing with the National Health Service. The more when they became reassured that they weren't going to be taxed and the budget wasn't going to be blown, they wanted to spend on health care. What happened with Obama was, and I'm impressed with it, he stuck with it. He never let up with, I'm not raising taxes for 95%. He did it to the end. I think you see, as part of that, a rise in support for addressing health care. Because I think I think the issue here is reassurance. And that has to do with reassuring that you're not losing your doctors, that you're building on current system, which is very different than what happened in 93, 94. And so assuming they're moving in a step-by-step way, I think once people are reassured that that this is that it's incremental, that it's building on, that these things, your choice of doctor is not at risk, I think they know how to reassure. And I think we know on what to reassure. That makes it possible to say, all right, I'll take the risk, of the change.
But don't you think if they do this in the initial wave, that it's got to be step by step, piecemeal kind of incremental approach rather than major healthcare reform? And how do they sell it? Do they sell it as major healthcare reform, or do they sell it as steps to improve health?
No, I think it's got to be big change, but it may be that it's step by step, over 10 years get there. But I think they got to know where it's going.
We may hear from the next panel and Chris Jennings that it turns out incremental is just as hard to do as the big thing, because people fight just as hard even when you're making small moves. I want to just shift the conversation a bit, because I want to tie this back to something Carolyn Clancy said in the first panel, which is about the need for engaging consumers more in their own health care. And getting to the issue of personal responsibility, which all the candidates spoke about in the campaign, essentially having people motivated to make a difference in their own health. Is the public ready for that yet? Is there anything that senses that people understand the degree to which their own commitment to their own health care and maintaining their health may have to change? Jim?
Well, you've probably done more polling on this than we. I'm not sure that there is that kind of public understanding now. But just picking up on the last point and then something more on this, we would support a really strong push for major reform. I think if you don't do it in the first go round, the notion that you can do it later in the first term or maybe in the second term, I'd be quite skeptical about. And I do think that there's a climate of a possibility of doing this. I'll come back again to tying it to people's real fears in the economic crisis that they're in. And we actually did a survey in the third week in October asking people, how are you responding to and reacting to the economic pressures, and what do you think needs to be done? And among the top, I guess it was 7 or 8 things that people said they thought it was most important to do for them, for their concerns. The biggest one was a concern about their pensions. But among those 7 or 8 top ones, 8 out of 10, approximately 8 out of 10 said they thought it's important to ensure affordable health care for all Americans. I was quite surprised to see that. 80% said that something should be done, Congress should act, or the government should act to ensure that no American would be without health care coverage if they're laid off or lose their job. That's 8 out of 10. Another nearly 8 out of 10 said that they should be ensured that you don't suffer financial ruin due to a major illness or an accident. So those things are very much on people's minds. So I wouldn't see them as two entirely different things. What do we do about the economic crisis for people, and what do we do about healthcare? I would try to link them and try to capture that opportunity. So that's what I would say there. And then a variety of ways to engage consumers. I think, yes, the leadership has to come from the president, and we're certainly seeing that there's strong leadership coming from Congress. But there are a number of organizations who are doing various things. We see Divided We Fail. We see AARP. We see some other campaigns about to put out advertising and so forth. One of my concerns is the dads right now from Divided We Fail is saying Congress needs to do something or the government needs to do something. Now I think there really needs to be a push around trying to educate people more about what's wrong in the system that's going to harm them and what changes can actually be to their benefit. So it needs to get more specific about it. But the third group that I would look to is the variety of organizations to try to coordinate better in really raising public pressure from the ground up.
I think it's going to be difficult trying to educate the public in terms of everything that's wrong with the system, and in terms of when you talk about the paperwork and the value for the dollar, and it's just. I think Americans will get confused very quickly on this. I think you've got to keep it relatively simple and address a few key issues. Put it under the rubric maybe of major reform, but once you get down to the details in this, we lose American voters. And keep in mind, their attention spans are pretty damn short right now. They are worried about losing their jobs. They're worried about losing their savings. And with all that, then comes the concern about health care. But when you have hundreds of thousands of people being laid off of jobs, the first thing is income they're worried about, then comes health care. So the more you dive into the details of the issue, the more you're going to lose them.
So what's the message?
Yeah. We lost this election.
All right, think about that. Think about the message for 10 seconds while we see if there are other questions in the audience. Yes, here, please.
Hi, I'm Eva Powell with the National Partnership for Women and Families. And my question is kind of a question, kind of a comment, and it springs off of what Neil just said. In listening to the whole conversation about value, the way we talk about value is very, very system and provider-centric. I have never been in a conversation where I've heard value discussed from a patient or a consumer perspective. And I think that might be... If we can begin to have those kind of conversations, we may address some of the very things that are sticky wickets, as this panel has talked about. And I certainly don't have the answers, but I'm wondering how we might begin to do that, because I think it does have implications for patient engagement, has implications for patients and consumers taking more responsibility for their health care. It has implications for what kind of policy decisions do we make to encourage some of these changes in the provider system in terms of medical homes. Are we going to just assume that if we are able to facilitate a medical home model that then would be more friendly to involving patients in their care? Is it just going to happen? And I'm not sure that while I think all those things are good, I'm not sure that I'm ready to make that mental leap of thinking if we reward providers for taking more time with their patients and involving them in conversations about their care, that we'll get to that next step, that there's really that patient-consumer interaction. So I guess my question then is what kinds of policy work can we do to really change the nature of the conversation to be truly patient-centered in the context of also having these conversations that impact providers and all the other players in the system?
Okay, so back to that question. What's the message? Stan.
Well, I'm going to use this question just as you made a statement to broaden the statement, but and to build also from the prior statement. One of the problems on part of the Republican argument or conservative argument has been overuse. That is, trying to bring healthcare reform that incentivizes a certain kind of use and puts more responsibility on individuals on whether they use healthcare services. People do not believe the problem is overuse by individuals. In fact, right now they're in an environment in which they can't afford to use it, and so they're looking for a change that allows them to use it more. And so how you make a systemic change that deals with different kinds of incentives for different kinds of behavior when people think right now their problem is being able to use the system, be able to afford to use the system, so I don't know how to make that change. I do think that I don't know if this is a message. I think there's a process here. I remember when President Clinton was elected and we tested his various promises, and we thought, well, can he go back on his middle class tax cut or this or that? And people basically said, you know what? If we trust him, that he's really acting in the long-term interest of the country, do what you think is right, and that is, you have space. To do this. What I'm worried about is that when we move to healthcare reform, you're going to see all kinds of interests who are going to pour into Washington, who are going to make their arguments and various kinds of arguments about what kind of provider, whether it's care at home or various things. There'll be a range of arguments on why each of these things make sense, but it'll look like a special interest, circus that's coming. And part of the reason why people don't trust government to do this is, one, they've seen an incompetent, corrupt government over the last 8 years. But why wouldn't they expect that if this government enacts healthcare reform, it won't be driven by all the special interests that dominate the process? So for me, the message is, how do you create a process in which I think the President Obama has to be the driver of this, in which people believe that the public interest will somehow, that the public is playing a role in this process, that the president is somehow allowing all the interests in civil society to get to the table without it being a special interest process. When people, if that turns, if it's seen as somehow, because I think the country wants to do this, but if they think that the public interest is the end product, that there is something driving it toward that, but the moment it crosses, and it very easily crosses the line to being just a bunch of special interests trying to shape this change in ways that favor their particular group, then you lose people. So the process may be the message.
What's interesting is just as we showed poll data here showing how difficult it is, the political environment actually makes this a little easier for Barack Obama. You have the mood of the country. Stan and I have polled all over the world. We have 10% right direction in this country. There are a few countries around the world that had lower than 10%. Americans saying 10% of people saying the country's headed in the right direction. The sense for change here is extraordinary. And Barack Obama has the opportunity to really use that mandate and begin to form this mandate for change. It's not going to come out of the Senate. It's not going to come out of the House. You don't look for leadership in the healthcare issue out of those bodies. You look for it at the top of the ticket. It's going to be Barack Obama who is pushing this mandate. And I think he can convince Americans to potentially take a leap of faith and use the bully pulpit of the presidency to knock down special interests and to push for this, so that Americans, almost kind of close their eyes and buy it, and they don't want to know the details. Details are too difficult for them to understand, but they trust this guy to make the kind of changes they want.
I would say, taking Neil's point on that, that's all the more reason why you've got this opportunity to really go for something substantial, because this opportunity isn't going to be there over and over again.
How does that square, though, with what people say about Barack Obama, which is that he is fundamentally a community organizer? He looks for opportunities to get people around the table to have buy-in. He's not going to, we're told, come up with the plan that will come out of the White House. He's rather going to turn to the Congress to have the kinds of efforts that Senator Baucus talked about this morning develop out of the system. So what is his role if he's really going to be the community organizer in chief here?
Well, having seen an administration design its health care plan, I'm all for having the Congress take the lead in designing it. But I do think the process is the message. He's got to oversee this process to make, so that this looks like, all the people who are trying to change the healthcare system get around the table and are acting and collectively they're acting in the public interest, and he plays the role of making sure the public interest is what dominates the process, and puts pressure on him when he needs to. But I think the process is the message.
I think we have time for one more question here.
Hi, Larry Lewin. Much of the support for health reform has come from consumer groups, and yet what often seems to block it are the powerful interests, and particularly the one group that patients listen to in the final analysis, which is physicians. For the first time, the AMA seems to be talking about approaches to reform. Do you see any hope of trying to build coalitions of support among providers and insurers for change, or are they just going to dig their heels in and we're going to hear from Harry and Louise as in the past?
Well, and I guess that's another question to ask. Who's the Harry and Louise of this cycle, if there is one?
Well, of course, Harry and Louise have been out in favor of reform now interestingly.
Right.
Yeah. Literally, Harry and Louise are the ones who did it.
I was going to my. I can't answer specifically, but I have to believe that those. I think this is a process in which people are encouraged from different, what were traditionally competing, polarized parts of society coming together because there's such a sense, not just change, there's such a sense of crash of having let this problem totally out of control, people in trouble. I think that creates an environment where it says people who've been on competing sides of this issue are somehow at this moment in time either forced to or want to come together to find a basis for going forward. And I think that's going to happen early in this process. I'm less worried about Harry and Louise than I was. I'm assuming the insurance industry has a lot to lose.
But I think what they're going to find is if they're convinced that change is coming, then I think they'll want to be around the table and help mold that change into something they can live with.
But what about the fact every provider group now has a plan for reforming the system that involves paying them more or creating more of them?
Right, in the public interest.
The primary care groups want the medical home to pay primary care providers more. The specialists are warning that we have a huge shortage of specialists coming.
You're surprised they're not suggesting that they said cut funds to me?
Well, to Larry's point, that people listen to their doctors. Their doctors are going to tell them that unless the plan comes out advantaging their particular part of the provider
can't afford to go to their doctors.
It's not going to happen. So aren't they in as powerful a position as ever to influence patients' opinion on this? And couldn't that potentially derail reform?
Well, that's probably true to some extent, but you talk to physicians today, there's a greater and greater frustration among the profession. And so I got to believe that there are elements of those in the physician community or the provider community, and I would look at nurses and I would look at other providers as well, that are frustrated with what the status quo is anyway. And so I guess I'll look at the glass as sort of the half full rather than half empty, in that I think that you can sort of pick off elements of the medical community to mobilize around significant change along the lines that's been talked about here. I mean, I'm not going to be Pollyannish about it, but I don't think it's going to be sort of monolithic opposition. I think one of the problems back in the 90s was they basically froze out the medical position, and that turns out, I think, to have been a mistake.
Mm-hmm. Neil?
I am not certain how much individual doctors are actually talk to their patients about these issues. We talk about that, but I'm not sure how much that actually happens, and I'm not sure how much the individual doctors want to have a voice in the policy process. It's American Medical Association certainly, but the individual docs, I don't get a sense that, at least I try to engage them when I go to the doctor, and there's a reluctance to really to engage in the details in the thing.
Okay, let's close this with a quick set of predictions. A year from now, where is healthcare going to be on the public's list of priorities for moving forward? Stan?
Very high, but the legislation moving into the next year, not passed yet.
Yeah, it'll still be number 3: economy, Iraq, then healthcare.
And Jim?
I'll say it's moved a little farther along. It may not have passed the kind of legislation we're talking about yet, but I was quite struck. I mean, Baucus is saying he's determined to try to do something this year, and if you do get the presidential leadership, which I think will be there, and strong pressure on Congress, I certainly think in the first 2 years, I would see major health care reform enacted. And it's got to be, can't be too far into the second year.
All right, we'll bring you all back a year from now and then 2 years from now to see if you were right. Join me in thanking this panel for a great discussion.